If you're getting side effects from taking iron supplements, then keep watching. We're going to go through the most common side effects of taking iron and how to prevent it. Iron is well known for causing side effects such as nausea, vomiting, constipation, bloating, diarrhea, heartburn, dark stools, stained teeth, and a metallic taste in the mouth. This can make you stop taking your iron supplements altogether, and we all know how important iron is for our body. So if you're experiencing gastrointestinal side effects such as nausea, vomiting, constipation, diarrhea, bloating or heartburn, then there are a few ways to try and reduce this. Number 1, try taking them with food. Yes, you've probably heard that iron supplements are best taken on an empty stomach, and you're correct. Most forms of iron are best absorbed on an empty stomach. However, if the side effects are so bad that you don't want to take it, then it's better to take it with food because at least you're getting some iron rather than nothing. Tip number 2, start with a low dose. Sometimes your body just needs to get used to it, so start with a lower dose if possible and work your way up. Tip number 3, alternate day dosing. After taking iron, our bodies produce a hormone called hepcidin. Hepcidin regulates the entry of iron in our body. So if our body already has a lot of iron, it'll make sure we absorb less. Studies have shown that after we take iron supplements, our levels of hepcidin in our body increases by about 24 to 48 hours. This means that if we take iron and then have another dose in 24 hours, less gets absorbed from the second dose as our body still has high levels of hepcidin. It is the unabsorbed iron that can cause more gastrointestinal side effects. Speak to your doctor about alternate day dosing. This will help to decrease the side effects and ensure better absorption of your iron. Tip number 4, lower but more frequent doses. There is a different theory that smaller doses of iron at a time can lower your gastrointestinal side effects. Although for some people, it may increase these side effects. Keep in mind that the amount of iron that gets absorbed may be less than with alternate day dosing due to increased hepcidin levels each time you take a dose. Tip number 5, slow release tablets. Slow release iron tablets are ones where the iron is slowly released throughout the day rather than all at once. These have been shown to cause less tummy upset. Tip number 6, different forms of iron. There are many types of iron supplements such as ferrous sulfate, ferrous fumarate, ferrous gluconate, iron polymaltose, iron bisglycinate, and iron protein succinylate. The ferrous forms of iron are usually cheaper but tend to cause more GI side effects. Speak to your healthcare professional about taking one of the other forms of iron to make sure you're getting the correct dosage. Let's talk about those dark stools that you're getting when you take your iron supplements. When this first happens, it can be a little bit scary as your poo tends to turn black or a dark green colour. This is a really common side effect and nothing to worry about. But if your stools become tarry looking, if there are red streaks in your stools, or you have severe abdominal pain, then make sure you speak to your healthcare professional. Liquid forms of iron can stain your teeth. To avoid this, you can mix your iron with water or juice and drink it through a straw. Make sure you don't mix it with milk as this can reduce the absorption of iron. Rinse your mouth and brush your teeth after you take your iron liquid. Another way to avoid teeth staining is to switch to tablets. If you do get the teeth staining, speak to your dentist to have the iron stains professionally removed. Iron is a metal, so it can cause your mouth to have this funny metallic taste. This is a common side effect, but luckily it's not harmful. There are things you can try to help with the metallic taste. Chewing on sugar-free gum, mints or lozenges. This can increase saliva, which can help to flush away the taste. Drink citrus fruits or juices. Add spices or acidic foods such as lemon or tomato to foods. Eat cold or frozen food. Avoid metal cutlery. Rinse mouth and gargle with salt and baking soda. Mix half a teaspoon of salt and half a teaspoon of baking soda to a cup of warm water. Rinse and then spit it out. So there you have it. If you have side effects from taking iron supplements, then try these tips and let me know what works. Don't forget to like and subscribe to support my channel. Thanks for watching and hope to see you next time. Bye!